everyone.
I am Jaren Kay Acosta with student ID number 1612633321.
I'm Cecilia Belda with student number of 1540-70221.
I'm Sarah Rose Lima with student number 162328231.
And I am Mary Jo Yap with ID number 127351237.
And we are the Quartet Group.
Our collaborative group assignment is all about elderly in long-term facilities in Toronto, ages 65 and above. The elderly population aged 65 years and older is experiencing significantly growth in long-term facility here in Toronto. According to Toronto Public Health, there is an increase from 15.6% in 2016 to 17.1% in 2021. This signifies that they need attention and resources. The focus of our study is to improve the quality of life for elderly living in long-term facility through proper assessment and increase awareness of their health issues. Why we choose this vulnerable group? We choose this vulnerable group because we observe that older adult ages 65 years and above faces health issues that needs to be addressed, like the mental health. Older adult experiencing social isolation and loneliness. They feel that nobody cares for them and they cannot do what they used to do. Older adult is risk for fall. In 2022, fall is a leading cause of injury for older adult ages 65 and older that resulting them to visit the emergency department and lead to hospitalization. Low-income older adults are likely to experience poor health. They're living in a low-income measure. As a result, they have the greater needs for healthcare services.
The assessment method that we use in our study is the population-focused assessment. This assessment is used to identify gaps in services and resources. This includes collection of data on residents' needs and current service provisions. Second, survey. We conduct a survey among residents, families, and staffs to gather qualitative and quantitative data on health conditions, satisfaction with services, and unmet needs. Approaches and tools. In our study, we use 3 tools, which are the quantitative survey, qualitative interviews, and data analysis. In quantitative survey, we use a standardized questionnaires to assess health status, service satisfactions, and environmental factors. While in the qualitative interviews, we conducted an in-depth interviews with the residents, caregivers, staff, to understand personal experiences and identify specific needs. While on the data analysis, we analyze the health records, the demographic data to track trends, and allocate resources effectively. The rationale upon selections of assessment and tools that we use in our study is first, enhance awareness. By focusing on the specific needs and challenges, we can increase community awareness and support for elderly care issues. Second, quality of life improvement. Identifying the gaps and areas for improvement helps in implementing targeted intervention to enhance residents' health and well-being. Third, effective resource allocation. Comprehensive assessment guide the allocations of resources and services, ensuring they meet the actual needs of the elderly population.
Our resources is Toronto Public Health and Canadian Institute of Health Information. The Toronto Public Health is for up-to-date data on population health and trends, and the Canadian Institute for Health Information, or CIHI, provides detailed insights into the health conditions and risks faced by the elderly. So why these sources? First is the relevance and specificity. Second is comprehensive data. Third is credibility and authority. And fourth is the accessibility of the resources. So first, relevance and specificity is Toronto Public Health provides data and resources specific to the City of Toronto, which ensures that the information is highly relevant to the population being studied. This allows for a more accurate understanding of the local context and the specific health challenges faced by the elderly individuals in Toronto. The second is the comprehensive data. As a local health authority, Toronto Public Health collects and publishes comprehensive data on various health indicators, including those related to the elderly population. This data is crucial for assessing health trends, identifying risk, and planning interventions. The credibility and authority is being a government agency. Toronto Public Health is a credible and authoritative source of information. Their guidelines, reports, and data are based on thorough research and are widely trusted by healthcare professionals and researchers. Lastly, the accessibility of resources. Toronto Public Health offers a range of accessible resources, including statistical reports, health promotion materials, and guidelines for best practices in long-term care.
The key organizations and stakeholders that share the same interest and are actively participating in decision-making for the benefit of our vulnerable group are the facility administrators. They act as one of the gatekeepers that implement changes and improvements within the facility. They work closely with the healthcare providers, like nurses, who are involved in direct contact of care to older adults. And another would be the residents with their families or their relatives. Their feedback, and most especially their support, is crucial for the success of every activities and program the facility will implement. Toronto Public Health, together with Canadian Institute for Health Information or CIHI, are key organizations that provides important data which can be used to improve and focus to specific health issues about older adults. Local advocacy groups also helps to address the poverty and inequity among older adults that lives in long-term care facilities in Toronto. To ensure that proper communication with all the said organizations and stakeholders, we set regular meetings and provide them the necessary and up-to-date information. We develop programs to further help and strengthen our vulnerable population. Programs like Nutritious Food Basket Survey. This is to closely monitor food affordability within Toronto. Another would be Fall Prevention or Injury Reduction, Getting Started Kit. It aims to help healthcare providers to implement and be more knowledgeable in strategies to prevent fall or injury among older adults. And lastly, physical activity and social engagement. We want to encourage active participation of our older adults. This will help to improve their health and mental well-being. For our nursing advocacy and ethical considerations, first and foremost, we have to respect and support their autonomy. That means their concerns, wants, and needs will be addressed. It is their right to be heard. Second is to ensure that we offer emotional and social support, not just for the residents, but also for their families. Safety and comfort of the residents is one of the most important aspects that we have to consider. Their living environment must be safe from any potential hazard, and all the health and safety regulations must be followed at all times. We also advocate for them by keeping them well informed and let them access resources to affordable medical programs.
In summary, assessing the needs of elderly individuals in long-term facility here in Toronto is essential for improving their quality of life. By using population-focused assessment method and utilizing a reliable data sources, we can better understand and address their specific needs. This initiative not only aims to enhance their care, but also foster greater community awareness and support. What have we learned? Through our study, we have learned that there is a quite number of vulnerable elderly population despite the progress and advancement here in Toronto. In long-term care setting, older adults with low incomes are more prone to experiencing physical and mental health issues, which increasing their demand for healthcare services. As a community health nurse, our role is vital in advocating and understanding their vulnerabilities to tailor care plans for physical and mental needs. This includes access to necessary services, to hear their voice, respect dignity, and provide high-quality care. The use of community assessments and effective communication helps in understanding their preferences and concerns, which guide care decisions and improve in long-term care setting. We, as a group, we learned the importance of working diligently, respecting different perspectives, and helping one another without being judgmental. At the same time, being responsible and accountable for every pieces of information we put in our group assignment.